This podcast was recorded on the ancestral lands on Treaty 1 territory, the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, and the Dene peoples, and on the homeland of the Métis Nation.
This is Humans on Rights, a podcast advocating for the education of human rights. Here's your host, Stuart Murray.
The 12th of December is known as International Universal Health Coverage Day. That is a big topic. And I am delighted to have somebody who is a local community advocate, community engagement specialist, and a community organizer to talk to us a little bit about the notion of what is international universal health coverage. So before I do a quick introduction, I would like to welcome Judith Oviosun to Humans on Rights. Welcome, Judith.
Thank you, Stud. My name is Judith Oviosun. I'm really excited to have this conversation, and thank you for inviting me.
Okay, Judith, thank you so much. So just by way of introduction, I can see why at the top of your resume, Judith, you talk about advocate, community engagement specialist, and community organizer, because you have spent time as the University of Manitoba Nigerian Students Association, the president. You've been the University of Manitoba Students Union. You've been involved in women's community representative in that regard. You're a healthcare aid supervisor, a Healthcare for All coalition. You're a community organizer for that. The Canadian Federation of Students Advocacy Campaign coordinator, and currently Occupational Health Center as a health educator. You also have a degree from the University of Manitoba, and it is a Bachelor of Science in Nutritional Science. And I noted on your resume that you were on the Dean's Honor Roll. So that's pretty spectacular. So there's more to your resume, but that's some of the highlights. Let's just get a sense about your background, who you are. Where did you go to school? What got you interested in becoming an advocate? And where did you sort of learn all of that skill that takes you to where you are today, Judith?
So I grew up in a very small town in Nigeria. It's called Katsina. It's a very small place, a small city. And I moved to Canada in 2015 to study at the University of Manitoba, where I had a BSc in Human Nutritional Sciences. I was an international student when I came to Canada, and I was very involved with my organization, the Nigerian Student Association, because coming here as an immigrant, that was where I could find like-minded individuals like myself who were experiencing the same issues. When I was there, the community was not very strong. We only had a few people, and I just wanted to build something that, a really good hub, because it helped me. And we were able to talk about some of the issues we had together. So I ran to be the president, because I wanted to reform the organization, and which was successful. We do have a very strong community right now on campus at the University of Manitoba with over 150 Nigerian students who are actively involved in the community hub that I created. As a president there, I did see a lot of issues that were affecting people, not just within my community, but other women as well on campus. And I knew that to create change, just talking about it was not enough, because I wasn't able to get much done just by voicing my frustration with the system, with the things that were going on campus. So in order to create positive change, I felt like I had to be at the decision-making table, which is something that I've found in common with a lot of immigrant advocates in Manitoba, as well as across Turtle Island, Canada. So I ran to be the women's representative, and I did that for a year. And I was able to sit on multiple boards. And the one I'm proud of is the Equity, Diversity, and Inclusion Board. Being there, I saw decisions being made and being able to impact those decisions and have a voice and make sure that they're being reflective of the community I'm representing was very powerful. And that was my first introduction to the politics of not just the student movement, but also the government and the provincial and the federal government, and knowing that, there are people at the table. And if you're not there to say your piece, a lot of times that would not be included in policy or decision-making processes. So, being able to be part of that board gave me a lot of experience and a lot of passion and more love for my community. And I wanted to do more. And so, I graduated and started working with the Canadian Federation of Students to continue that work.
So, Judith, advocacy leadership is really a part of what you are very passionate about. Can we just sort of go back a bit? So you were raised in a small community in Nigeria. What brought you, or what was your connection to come to Canada and or Manitoba and then Winnipeg?
I had applied to other universities at that time. I wanted to study abroad because I wanted to study medicine or nursing, but I wanted a place where I could do a lot of practicals or have access to world-class technology, laboratories. And at that time, Canada was very popular in Nigeria, and they were welcoming a lot of international students. Manitoba was, for me, by chance. I did not know anywhere in Canada when I applied. When I was looking for admission, University of Winnipeg was the only one offering rolling admission at that time. That was why I looked towards Manitoba and then eventually University of Manitoba. But I didn't have any specific reason why I came to Manitoba. But I really have enjoyed my time here, and I love it, although it's very cold.
Yeah. So how many years have you been in Manitoba, Judith?
I would say over 6 years now, 2015 to 2022. It's been over 6 years.
And you decided that you were going to spend a bit of time at the University of Manitoba. That's where you got your Bachelor of Science and made the Dean's Honor List. I have to say that again, because that's impressive. But is that where you were looking at maybe getting into medicine or your nursing? Is that why you maybe chose that path?
Yes, that was why I went there, because at University of Winnipeg, they didn't have those programs. So I thought it was easier for me to go to University of Manitoba. That way I could. But being at the University of Manitoba and quickly realizing, tuition was going up, and it was just getting more and more I couldn't afford to study nursing because of the high cost of tuition, or even medicine because as an international student, that's not a direct path until you become a permanent resident. So that was the dream that brought me here. But very quickly, you can see it's kind of shifted to more community organizing and advocacy, which I've enjoyed.
You have been out in the community doing a lot of things, advocating things, Judith. And that's really, I think, as you said so well at the beginning, you have to be at the table. Your voice has to be heard if you're trying to impact or affect change. So, Judith, can I just ask you a little bit then? Let's talk a little bit about this notion of universal health coverage. I don't really want to get into all the politics of it, although there's a lot of politics involved, and I get that. But share with me and those that are listening your experience as an international student around universal health coverage.
For me, I would just say I believe that healthcare is a human right, and we should all be able to access it, regardless of our immigration status. And that's what a lot of the organizations I work with, they strongly believe in that. As an international student, when I came to Manitoba, I was able to enjoy the privilege of having healthcare coverage extended to international students at a time. So contrary to opinions that have been out there that international students are reaching on to the healthcare system, I wasn't using it too much. I knew I had it. It was just such a relief to know that if it does ever go wrong, I have this opportunity to see a doctor without having any issues. And so, for a while, no one really had any issues. Everyone was able to access healthcare. I was able to see the doctor, and it was very smooth and easy. It was in, I believe, 2018, and that we got the news that healthcare coverage would no longer be extended to international students. It was a really stressful, devastating month, I guess, for a lot of international students in Manitoba, because we didn't know what to do. If healthcare was taken away. Before coming here, I don't think I really knew what it cost to even visit a doctor. So at that time when healthcare was taken away, you have to like factor in all those extra expenses. And it was not possible for any international student to be able to afford that on their own. So of course, student unions rallied around and university administration to find private health coverage, which was kind of like a solution, I guess, to that announcement that was made by the government. And like you said, it's hard not to get political because the healthcare system in Canada, in Manitoba, is very, very much political. So it's just happened that we were able to get the private funding, and a lot of the cracks weren't really seen immediately because of course it was new. We had private healthcare coverage and everyone was relieved. Like it was a sign of relief. Okay, well, this has been done. We have private health coverage. At least we don't have to pay out of pocket. But very quickly we started seeing like some of the issues slowly. I know one of them was having to get a family doctor, and a lot of the clinics, some of the clinics would be like, I can't direct bill Blue Cross, so you have to pay out of pocket. And it's, yeah, very devastating because like people don't have $120 to pay a doctor first and then get reimbursed later, because that would take weeks, and that's money out of your pocket that could have gone for food or for something else. So it was a very minor inconvenience that we noticed like very quickly, but it went on for years. Like students were struggling because now you have to think, oh, if I go to the doctor, I might have to pay out of pocket first. But there are some clinics who don't ask you to pay out of pocket first, but it depends also. Like getting a family doctor, as you know, in Canada is it's a very long process. And sometimes you might get doctors that can direct bill Blue Cross, and sometimes you might not get doctors who can do that. So would you like rather be on the wait list again for another year waiting for a doctor so yeah, there was a lot of struggles with that. But during the pandemic, we did see a very huge crack to show us that, private healthcare insurance is not really working as we all expected it or as we all hoped to work for it to work. So there was a lot of issues that went on, and that's where you get to go into the politics of healthcare. But
No, and thanks for the explanation. Can I just maybe look at your personal experience? So, as you say, you've come from Nigeria, you're come to Canada, Winnipeg, and you're studying, you're at the university, you're an international student. If you needed to go to see a doctor, assuming that that again, there's sometimes a shortage of doctors, but assuming that you were able to see a doctor, at that time you were able to go and see a doctor, you would show your health card or your student card and you would be seen by a doctor and you would get looked after, get treated, and then, you go back to your regular life. Am I accurate with that?
yes, like it was just how any other person in Manitoba was accessing healthcare, which was great. Like you go, you see a doctor, have the Manitoba health card, which was really good. They accept that. Every hospital accepts that. So you never have any issue of like, oh no, you're an international student, I can't attend to you. So it makes it easier and quicker for you to even get access to healthcare, which was amazing.
And then the change, Judith, that you talked about was that when international students were no longer given a health card, you then had to seek private health insurance.
Yeah, this was like an effort with student unions and university administrations. They had to find like private healthcare coverage because it's, like I said, it's impossible to stay here without any form of coverage because healthcare can be very expensive.
For sure. And so was that done from an organization standpoint, Judith, that then, you went to Blue Cross or you went to a healthcare provider in that regard? Was it done on behalf of the university international students, or were you on your own, or what was the process that allowed that to unfold?
Yeah, it was a negotiation, I believe, that was done like by student leaders at that time and with the help of the administration to find something. So I'm not sure who went to who. Yeah.
Fair enough. Yeah. No, thank you for that. I'm just obviously trying to get a sense of it from your personal experience. So now, what situation do you have? You've been in this country in the province, in the city for, as you say, up to 6 years. What do you have now for health coverage, if you don't mind me asking?
Last year, I became a permanent resident of Canada. So I do have the Manitoba health card, which, yeah. So Yeah, but before then I was on the private healthcare plan.
And one of the things that, when you look at the fact that the federal government of Canada has for years, through transfer payments, been a big funder of provincial healthcare, and provincial healthcare ministers oversee those budgets. And when the federal government starts to cut the transfer payments, and this is where you say it's hard not to get into politics, but the provincial government then is responsible for administering the healthcare that they can to their citizens. And I wanted to just come back to the title kind of our podcast, which we wanted to talk about, which is universal healthcare coverage. And I wanted to just get a sense from your perspective, Judith, when you hear universal healthcare coverage, do you automatically think about it being free, or do you think that universal healthcare coverage should be accessible? In other words, you may have to have a fee to pay, but you can get access to it, versus some countries in the world where, it's just not accessible at all. Forget about having a cost to it.
And I hear universal healthcare coverage. For me, I feel like accessibility is number one. You should be able to have access to care. But when we're talking about accessing care, you have to also factor in that if care is expensive and you have a fee, that's a barrier on its own. So for me, it has to be free and accessible, because if you have to go to the clinic and they're telling you have to pay a certain amount before you get access to healthcare, it's no longer like rights. I'm looking at it from a human rights perspective, the lens I do all my work in. It's like it has to be free and accessible for everyone, regardless of your, status in the community, so that, that way people can access the care that they need whenever they need it.
Hmm. And one of the things, Judith, I think that is always part of I'll just say the healthcare debate is, the notion about healthcare being free. I just went to get my physical checkup a week ago. I made an appointment. I walked in, I saw my doctor, got my annual checkup. We shook hands, we had a little conversation, and I left. In other words, there was no payment, there was nothing. So, the notion of that exercise is that when there's no payment, it's free. But when you step back and you realize that, and again, this kind of comes to the political side of things, that governments, they're the ones that have to, through, collecting taxes from people that work, collecting taxes from various areas that go into the provincial treasury, and then they decide how they're going to fund healthcare, is that the notion that the visit may be free, but the cost of running healthcare is extraordinary. It's such a big number. And I wonder sometimes if we do disservice, if I could say it this way, Judith, to the debate when we talk about free healthcare.
I really do understand, like, yes, healthcare is free for the people accessing it, but yes, the government has to pay. And I'm really glad you brought that up, because this is one of the myths that we've been trying to talk about with people in the media and community, that whenever we have free and accessible healthcare, we're adding that international students free healthcare without contributing anything to the Canadian economy. But that's not true, because international students have been a very good part of our economy in Manitoba. And in fact, the federal government alone is even recognizing their efforts and their hard work now, because they're increasing their work hours from 20 hours a week to now 40 hours a week. So they know that these people are contributing to the economy, and that's why they're using them. But the thing they're failing to understand is that it's not enough to just move the work hours from 20 to 40. Like, now they have to work more and go to school. They have health challenges that take care of. So extending healthcare coverage would be very important to maintain, like, a healthy mind, body, and soul, to be able to task that the government has, like, it's expecting of them now, with working 40 hours to cover the labor shortages all across Canada. And also, like, everyone's paying taxes in Canada. All immigrants pay taxes. Like, taxes is not something you can even escape. So when we talk about the expense of, other people having healthcare and some others don't, like, we're all paying taxes, and everyone migrated at some point, and we're all going to be able to pay our own dues to the tax system. So it's very frustrating where I hear people in the community say, well, oh, we pay taxes and why should we be extending healthcare to these people? Because yeah, they're also paying taxes. They're paying taxes to their tuition. They're paying taxes by working part-time, and now they're expected to cover labor shortages. So yeah, it is expensive, but if we're also contributing to the system and to the economy, I think at this point, the only thing that would be the government can really do to make life a little bit easier, because tuition is already expensive, is to extend healthcare coverage.
A couple of things there I'd just like to sort of come back to. Explain, if you will, the notion that the federal government has moved, you mentioned it, from 20 hours to 40 hours. So can you explain what does that mean? What impact does that have with respect to international students?
Yeah, so as an international student, when I came, you go to school full time and the government allow you 20 to work. National students can work 20 hours a week, and this can help you with your accommodation, feeding, and just well as like minor expenses that you would need so that your parents or sponsors can focus on paying the tuition, which was really helpful. A lot of international students benefited from that, you know. And so students were paying taxes through that as well. But now, with the labor shortages all across Canada, the federal government has agreed to increase that work limit. It was 20 hours before, but now they can work up to 40 hours a week.
Was that something that was fairly monitored? I wasn't aware of that, so I appreciate you sort of clarifying that. But did somebody monitor the fact that you could only work 20 hours?
Yes, I mean, it was monitored to the extent it was monitored. I do not have information, but seeing international students who have gotten into trouble working more than they're supposed to. So yeah, it probably would affect you later on. It depends on, you know, news. There was a time where an international student in Ontario that was driving a truck got caught for working more than 20 hours a week. And so that affected his stay in Canada. And there was a whole news about him possibly getting deported. So yeah, there are cases like that where students get caught working more than 20 hours. But the monitoring aspect, I'm not sure how the federal government keeps track of that.
I was just curious to see. I mean, you know, to your point, the notion that they've allowed international students to increase the number of hours from 20 to 40, you know, hopefully it doesn't impact their studies. But I can, you know full well, there's such a shortage of labor in certain markets for certain areas. It's incredible. Some restaurants are struggling because they don't have enough people to work there. So hopefully that's a good opportunity for international students, as I said, as long as it doesn't impact the reason they're here, which is for their studies. And the other thing I should think it's worth pointing out, Judith, is that international students, when they come to attend a university, I'd have to say in Canada, but we'll talk about Manitoba, their tuition fee is extremely higher than what it is for a local resident here to attend at the university. So you're paying a premium to come into the university, which I understand from the university's perspective, it helps in terms of their budgeting. But that's another additional cost that international students have to bear.
It is another burden for international students. And I know, like, when healthcare was taken away, let's go back to that. The university understood the situation. It put a lot of international in, because as a student, you have to make your budget. Your parents or whoever's sponsoring you, you have to have a budget. And because that announcement was so sudden, the university had to even arrange for healthcare relief fund to help international students cover for, I think, part of the healthcare coverage that they had to pay. And yeah, you have to apply for it. And it was not, and then if you get the relief fund, but just show you how much expensive it is to come here and budgeting and everything. And then having like suddenly healthcare taken away, and that is getting added to the cost of tuition as well. So tuition also in Manitoba is going up every year. Like, so with that, and the cost of healthcare is going up as well. I know when it was taken away, we were paying about $600, but the last time I checked, it's about $1,000 now. So everything is going up, and I know it's inflation and everything. Yeah, it's getting really expensive, international student.
Yeah, no, I mean, we could probably have a whole other podcast talking about inflation and being a student, and the costs of what that means and how you sort of navigate that. As a somebody who's spent time and you're very passionate about having a voice at the table, you're passionate about being an advocate, you're passionate about being a community organizer. If somebody were to say to you, you got a call, say, from the Minister of Health or the Premier to say, Judith, what advice might you give government to make sure that we have proper universal health care for all, knowing that there is the politics and the budget involved? Would you be able to sort of provide your thoughts on that?
I feel that's a very tricky question. I do not have the intel in terms of like being in the government to fully answer that. It has to do with budgets. I know the government can provide that if they want to. It just has to do with like, priorities. And time again, I've seen the community. I think it's time for us to understand that healthcare should be a priority because don't have a healthy population, you don't have your economy is not going to flourish. The earlier we realize that, the better. And so I would say, like, as a government, the first thing is to prioritize healthcare and make sure that we do have something that not just international students, but even like those who have access to Manitoba healthcare are struggling. So it makes us wonder if, healthcare is being prioritized. If I do get a call like that, I would be like, we need to prioritize healthcare. In terms of what that looks like, it might have to do with, it has to definitely go back to the federal government, obviously, because they have to also be able to release more funds for provinces. But I can't really fully answer that without knowing the budget that the Manitoba government is working with. But yeah.
Yeah, no, and again, I just appreciate your answer. So thank you very much. And it was just really wanting to see, from your perspective, there's so many people that have advice around healthcare. And one of the things, Judith, I think that, frustrates the conversation, if I could use that term, is that a lot of people talk about how much money we're putting into healthcare now and how much more money we've put in from this last budget into healthcare. And the numbers are big. The numbers are massive. So there's an analysis on how much money we put in, but there never seems to be an analysis on patient outcome. How are our patient outcomes doing? Sort of measure, what does that look like? And it is a very complex subject matter, but I know that Canadians, sometimes if you take their temperature on the surface, they're very proud of our healthcare system on the surface. And you hear time and time again that it's hard to get in if you need care. But once you get inside the system, you get amazing care from the people that work in the system. And that is one of those areas that I think we hear time and time again. And you just wonder, when you look at somebody from your perspective, you've been in this country now for 6 years, you have a degree, you're very active, you've got a voice, you've got a sense of leadership, that we can't just keep going on with the status quo with healthcare, because it's not about more money, I don't think. I just wonder if you could respond to those thoughts that I just shared.
Yeah, I do not have as much expertise in that aspect to answer that question fully right now. I do believe there's a lot of work that needs to be done in terms of like the healthcare system in Manitoba. There have been a lot of things I've seen in terms of that, of course, I don't agree with. In terms of what should be done right now, I'm not sure how they're prioritizing healthcare, because just throwing more money at it is not going to do anything for us. And for me, it's more like where the money is being placed, I guess. I've been seeing a rise in like agencies, like privatization of a lot of healthcare work. And of course, it's helping to reduce the backlog and create more accessibility. But it's tough question to answer just right now on the call. But yeah, there's a lot of work that needs to be done. But my advice is that the government should send to community organizations, grassroots community organizations, ones doing the work. They're on the ground, the nurses union. They're the ones that are working with patients on a daily basis. They have in-depth knowledge about the crisis and ways that could be like, mitigated. So I feel like more conversation needs to be had at the grassroots level for the government to be able to move forward.
I think that's a great suggestion, Judith. And the other piece, of course, that with all of the challenges of healthcare, then along comes COVID, which has just been a tremendous burden on the frontline workers, and we've talked about that publicly, that we have to support our frontline workers who did an amazing job. I'm not sure we did a good job supporting them. I mean, a lot of conversation about it, but I have to say that I made a choice. I wanted to get my COVID vaccine. And so I would have to say that that process that was set up here in Winnipeg, my experience is they were amazing. They were friendly. They were professional. They had a lot of challenges at the beginning trying to sort of navigate the system because there's so many people trying to get into it. But I mean, I think that's just natural. And I think people here in Manitoba, there's always going to be people that are not happy about something, Judith, but overall, and I would just speak on behalf of myself, I thought that the process worked extremely well.
Yeah, I mean, the progress overall was amazing. I mean, the nurses are amazing. The healthcare workers in Manitoba are awesome, and they've been doing a great job. I mean, they were thrown into this whole pandemic without very much resources, and at a time where there had been a lot of cuts to healthcare, like closing a lot of ER, and we were working with only a few, and they really rallied around and did an amazing job to utilize the few resources they have. But when we talk about the process of the pandemic, I mean, it was helpful, but was it equitable and accessible to everyone? That's where my question comes back. I mean, immigrants had a hard time, refugees, international students had a hard time accessing COVID-related healthcare for a while. And they also had a hard time even accessing the vaccine and getting vaccine passport. But due to grassroots advocacy from organizations and have worked with in the past, we were able to get some wins from the government. But I think the government needs to do a lot more. I mean, in Ontario, healthcare was, most immigrants were able to access a lot of care during the pandemic. And it wasn't so for Manitobans because we saw an international had a mental health problem. And it was in the middle of the pandemic where you would think that that should be something that would be covered as a, COVID related illness, just being in the pandemic. And a lot of Manitobans struggle, like we all struggle through the pandemic with some form of mental illness problem or the other. So just having that person being charged over $40,000, almost $40,000 in hospital bill, is another barrier that a lot of immigrants, international students, refugees had to face during the pandemic. And those are just the people that were brave enough to say their stories. Yeah.
So Judith, sorry, just I want to make sure that I'm understanding what you're saying is that there were international students or immigrants in Manitoba that had to pay, did you say $40,000 for a hospital stay?
Yes, the bill was almost 40,000. I think that over 30,000, I would say, in terms of hospital bill. And they were experiencing some, mental health challenges during the pandemic. And instead of being at home and getting worse, decided to go seek help. And after being in the hospital for 9 days, they were charged, over 30,000 in hospital bill. So
did they give that to them as they were leaving the hospital, or how did that work out? Or are you aware of that process?
It wasn't given to them as they left the hospital. I haven't heard them do that, but you'd get a letter at least to tell you this is how much you're owing. And so getting that letter is enough on its own. It's very devastating to have to, relieve that experience of, having that challenge and now putting yourself in that much debt. So, and that's not the only case. There were a lot of cases that came out of the pandemic. A lot of them we could spend another hour talking about each and every case, but yeah.
And that's simply because they were immigrants and did not have a Manitoba health card.
Yes, they were an international students and didn't have Manitoba health card. Yeah.
And they didn't have the ability to have private care also at that point?
A lot of people were in between courses or in between universities. So things happened that could have warranted them being uninsured for not being able to access the private healthcare insurance, because that is tied to their enrollment in the university, which is another layer of accessibility
I just want to come back to your comment earlier when you talked about accessibility of healthcare and making sure that it's accessible to everyone. And when you look at it particularly as a human right.
Yes. And that just showed that it wasn't accessible.
Yeah. I mean, Judith, one thing that you have done is, through the various organizations that you've taken leadership role, whether it's the Nigerian community, bringing them together and creating that community, or whether it's been out advocating, went on a campaign with the Canadian Federation of Students, you are somebody who has a belief and you take your time and you add your voice to it along with others. And I think I'd make this comment that I thought was an interesting comment, that it really goes to the power of advocacy or education. And somebody said that, if you have pride with the current system, if whatever that system may be, we're talking healthcare, universal healthcare coverage, if you have pride in that system, you should never be afraid to challenge it to try to see if you can make it better. And I think that's what you're advocating.
Yes, exactly. Yeah, the system could be better. It could be better for everyone, every one of us that are here. And that's what we want to see. That's the ultimate goal, to make sure that we all have the same access and we can access and healthcare whenever we want. So yeah, just trying to make it better all the time.
So, Judith Oviosun, you've been a great guest today, but I want to leave kind of the last word to you. Just what are you working on? I mean, you're a community organizer, you're an advocate. Is there anything you want to share that you're working on right now? Or maybe there's a couple of things that you're working on?
There's a couple of things I'm working on, but one that I'm really excited about is the Alliance of Gender Justice in Migration. It's kind of a project that is funded by Women Equality Canada. And this project is looking at immigration and adding a feminist intersectional perspective to it, to make sure that immigrant women are able to access services and immigration services, most especially whenever, because there's been a lot of issues in terms of like women trying to access those services in Canada. So yeah, I'm really excited to do that work. It's a Pan-Canadian task force. We do have organizations all across in BC, Ontario, Quebec, and Manitoba, and we're working to make sure that we center the voices of women with lived experiences.
And that sounds fantastic. And I'll ask you if you would send me something on that. So, when I put the podcast up, I'd like to make a reference to that. So if people are interested in finding out more about it, maybe specifically share what it is that, are you working with this because you're trying to sort of change federal legislation or provincial legislation, or both?
Doing this is more of a federal. Immigration is first and foremost federal before it's even provincial. We do have some provincial immigration policies like the Manitoba provincial nominee. So we still hope to influence that as well, but the focus is more of like a federal wide, because we have a lot of women that come here and experience like gender-based violence, and but because they're tied to this spousal visa sponsorship, they have a hard time. And there's a process around, but we're trying to evaluate how accessible that is for women. And there's a lot of like people that we've seen that have tried to go through that process and have experienced a lot of issues. So making the process as easy as possible is kind of the goal here.
Wow, that's great. Yeah, no, thanks for sharing. I can only say that at some juncture, having just met you, that I would look forward to having you on again on this podcast to talk about those issues, because the whole purpose of this podcast is really to talk about human rights, humans on rights, talk about advocate, talk about education. And that's really sort of very strong and right in your wheelhouse, Judith. So thank you very much for spending some time with me this afternoon. And if there was one thing you wanted to leave anybody that's listening to this podcast about, universal healthcare coverage, what would that be?
We need a system that works for all of us. So I do encourage everyone that's listening to join us in this, so that every man can access healthcare without fear of, being deported or fear of being in financial hardship. So yeah, I'm looking forward. And also, aside from just this, it's also a very good time for us to also remember Indigenous sisters. With the recent news in Manitoba, I think that the work can't be done alone. Like, we have to stand with Indigenous women in Manitoba and across Canada in this fight as well. So yeah.
Judith Oviosun, thank you so much for being on this podcast. I appreciate your time.
Thank you.
Thanks for listening to Humans on Rights. A transcript of this episode is available by clicking the link in the show notes of this episode. Humans on Rights is recorded and hosted by Stuart Murray. Social media marketing by Buffy Davey. Music by Doug Edmond. For more, go to humanrightshub.ca.
Produced and distributed by the Sound Off Media Company.